Welcome, everyone. Today, we're jumping right into a brand new explainer, and we're tackling something absolutely crucial, but often completely invisible. We are decoding the official blood pressure screening algorithm. Now, we've all probably known someone who seemed perfectly healthy, right? Maybe even super athletic, but then suddenly suffered a heart attack or a stroke seemingly out of nowhere. It's a pretty terrifying reality, but the good news here? There is a clear roadmap to prevent it. So let's dive right in and decode exactly how you can measure, understand, and really protect your cardiovascular health. So here's what we're looking at today. We'll start with the silent health killer. Decode exactly how blood pressure works, figure out your BP numbers, uncover those hidden risk factors, and wrap up with daily habits for better health. Let's get to it. Section 1. The silent health killer. Why fitness isn't everything. All right, so I want to kick things off with a question that might honestly surprise you. Can you pass a really rigorous physical fitness test, but still be at a serious health risk? The answer is a resounding yes. Every single year, healthcare providers see incredibly active individuals. I'm talking military personnel, athletes who can run miles, march all day, and crush their fitness tests, but actually have dangerously elevated blood pressure. And this perfectly highlights a really dangerous misconception we have. It's super easy to confuse external fitness with internal health. Don't get me wrong, physical fitness is amazing. It builds strength, it builds endurance, and it gets you operationally ready. But physical fitness alone, it just doesn't tell the whole story. You could have fantastic muscle tone on the outside, while on the inside, your cardiovascular system is working under this immense, hidden stress. It's quietly doing real damage to your blood vessels, your heart, and your vital organs. And that brings us to why high blood pressure is notoriously called the silent killer in the medical world. Why? Because it sneaks up on you. It can develop silently over years with absolutely zero symptoms. None. You might feel totally normal, you keep working, you keep exercising, living your best life, while under the hood, damage is already being done to your brain, your heart, and your kidneys. Seriously, a lot of folks only find out they have hypertension after a major, life-threatening complication hits. Section 2. Decoding blood pressure. Understanding the mechanics. Okay, let's strip away all the clinical jargon for a second and look at the mechanics. Think of it like the plumbing in your house. Blood pressure is simply the force of the water, or in this case your blood, pushing against the pipes, which are your arteries. It's recorded in two numbers. That top number, that's your systolic pressure. Think of it as the active force. It's measuring the exact pressure inside your arteries the very millisecond your heart squeezes and forcefully pumps blood out to deliver oxygen everywhere it needs to go. Now, that bottom number is your diastolic pressure. This is the pressure in your arteries when your heart is just resting between beats. It's basically your system's baseline stress level. And both of these numbers are incredibly important because together they give us the full picture of exactly how hard your cardiovascular system is working around the clock to keep you alive. Section 3. Know your BP numbers, the screening algorithm. Now, take a look at this starting point of this official screening guideline. The very first question it asks is so simple. Are you 18 years old or older? If the answer is yes, you need to get your blood pressure checked. That's it. Preventative screening isn't just for older folks or people who are already feeling sick. It's specifically intended for every adult who appears perfectly healthy, just to catch those sneaky hidden risks early on. All right, let's actually break down the numbers because knowing your reading is exactly how you take control. If your numbers are less than 120/80, you are normal. Keep up the great habits. Now, if you're systolic, that top number creeps up between 120 and 129, but your diastolic is still under 80, you're in the elevated category. You don't have hypertension yet, but consider it a blinking yellow warning light telling you it's time for some lifestyle tweaks. But if you hit 130/80 or higher, you've officially crossed over into high blood pressure, and it's time to check in with a healthcare provider for a real assessment. Now, we absolutely have to talk about the red alert zone. If your blood pressure reading hits 180/120 or higher, and you're experiencing warning signs like chest pain, trouble breathing, a blinding headache, weakness in your face or limbs, or even confusion, listen to me. This is a hypertensive emergency. Do not wait. You absolutely must seek emergency medical care immediately. And here is a very crucial warning straight from the source material. Please, do not try to self-medicate based on one single high reading. If your numbers are up, your healthcare team has to run repeat measurements, do laboratory testing, and assess your real risk before prescribing anything.
Proper diagnosis literally requires professional evaluation. Don't try to wing it. Section 4. Hidden risk factors. Who needs frequent monitoring? So, who actually needs to be checking their numbers more often? Well, if any of these key risk factors apply to you, you're in a higher risk category. We're talking about being overweight or obese, dealing with diabetes or kidney disease, smoking, having a family history of hypertension, being 40 years old or older, or just living a sedentary lifestyle. If you're checking any of those boxes, regular screening isn't just a good idea, it is a critical shield for your future health.
Section 5. Daily habits for better health, taking control.
Okay, here is the most encouraging news from this entire explainer. High blood pressure is incredibly manageable, and it's highly preventable. If you find yourself in that elevated category or you just really want to protect your heart, these daily habits are your absolute best defense. First, cut back on the salt. Get moving and exercise regularly to keep those pipes strong. Maintain a healthy weight. Ditch the smoking and dial back the alcohol. And honestly, don't ignore this last one. Manage your stress and make sure you're getting actual sleep. I know they sound simple, but these small habits, practiced consistently, create massive health benefits over time.
Which brings us perfectly to our final takeaway. Knowledge protects, prevention saves lives. It takes, maybe a couple of minutes to get your blood pressure checked, but that simple act can literally stop a crisis before it even happens. So I want to leave you with this provocative thought. You might be strong enough to crush a fitness test today, but are you brave enough to find out what's really happening inside your arteries? Don't wait for the silent killer to introduce itself. Go get your numbers checked. Thank you so much for joining me for this explainer, and I will see you next time.